Our next finalist is John Williamson from the Department of Communication Sciences and Disorders. Dr. Emi Isaki is his major professor. The title of John's presentation is Facial Affect Recognition Training Through Telepractice for Individuals with Chronic Traumatic Brain Injury.
All right, thank you. My name is John Williamson. I studied facial affect recognition training in individuals with chronic traumatic brain injury. To start with, traumatic brain injuries result from an external blow to the head. For example, in a car accident. Over 1.4 million individuals each year receive treatment for traumatic brain injuries. One of the primary effects of traumatic brain injuries is that individuals may have deficits in theory of mind, which is the ability to understand and interpret what others might be feeling and thinking. And a subset of that is that they may have deficits and difficulty understanding how people are feeling through their facial expressions. This can lead to communication breakdowns. This can lead to isolation, divorce. It can lead to depression and all sorts of other personal issues. And so for my training, I looked at 2 individuals with chronic or long-term traumatic brain injuries, and I looked at the effects of the therapy, or where they were at pre-therapy, and then how the therapy had impacted them and their ability to read facial expressions. I also utilized telepractice. So the individuals received therapy through a video-based teleconferencing system, which allows us to reach individuals living in more remote areas. And I had 3 parts to my therapy approach. The first part is pictures of facial expressions, and I asked the individuals to identify the emotions on those pictures of individuals. The second part was asking the individuals to reflect on their personal emotional situations and how those situations had made them feel and what that even physically made them feel. And then finally, I asked them to think about social stories and lines of dialogue and to pull the emotions out of those lines of dialogue and discuss what emotions were being expressed, including sarcasm, because that's very common. The benefits of my therapy approach can assist individuals in improving their relationships, their personal relationships, their work relationships, can help them feel less depressed, can really help them get out of their shell. And adding in the telepractice element really allows us to work with individuals who may be living in more remote parts of the U.S. and may not have access to in-person therapy or may not feel comfortable coming in to in-person therapy. So we don't want this to happen, and so this therapy can be very, very effective for preventing those emotional and relational breakdowns that can negatively impact people's lives. Thank you.